Bismillahirrahmanirrahim. I'm Dr. Yasmeen Ahmad, and today we will study about the conducting system of the heart. Earlier, you have studied about the structure of the heart walls, and now you will study about the conducting system of the heart. In this first picture, on the left side, you can see the coronary arteries present in the heart. These coronary arteries is responsible for the blood supply to the heart. There are two types of coronary arteries, right and left coronary arteries, and these right and left coronary arteries are further divided into the smaller branches for the blood supply to the heart. On the right side, you can see the interior of the heart, and interior of the heart shows the chambers on the right side, and on the left side there is right atrium, right ventricle, and left atrium and left ventricle. So in this picture you can see the flow of the blood in the heart. The largest veins in the body is the superior vena cava and the inferior vena cava. You can see the superior vena cava present on the upper side of the right atrium, and the inferior vena cava present on the lower side. And blood from the different part of the body, from the whole of the body, the deoxygenated blood is being carried from these two venas, superior vena cava and inferior vena cava, to the right atrium, and from right atrium the blood is pushed into the right ventricle, and from right ventricle the blood is being pushed through the valve into the pulmonary trunk, and the pulmonary trunk is guided by the pulmonary valve. You can call that pulmonary trunk also the pulmonary artery, the only pulmonary artery, the only artery in the whole body that carries the deoxygenated blood. And in the lungs, this deoxygenated blood is being oxygenated, the gaseous exchange take place, and then the pulmonary veins carries the oxygenated blood, comes to the into the left atrium, and from left atrium into the left ventricle, and from here left ventricle into the aorta, and from aorta to the different parts of the body. So you can see the flow of the blood. The blood flows from right atrium into the left ventricle, and from left ventricle into the pulmonary trunk through the pulmonary valve, and from the lungs through the pulmonary veins. The oxygenated blood comes into the left atrium, and from left atrium the blood goes to the left ventricle, and left ventricle, the blood, when the ventricle contracts, the blood is being pushed into the aorta, and from aorta into the different parts of the body. So there is a valve present in between the atrium and the ventricle, and both sides there is a valve present. There is tricuspid valve present in the right side, in between the right atrium and the right ventricle, and there is a bicuspid valve present in the left atrium and the left ventricle. And the aorta is also guided by the aortic valve, and the pulmonary trunk is also guarded by the pulmonary valve. So main topic of today is the conducting system of the heart. Okay, heart generates its own electrical impulses and beats independently of the nervous or hormonal control. So this is known as the autorhythmicity. Main property of the heart is the autorhythmicity. Autorhythmicity means it is independent of that hormonal or the nervous control. It generates its own electrical impulses. You can see in the next slide, from the next slide, that how it originates its electrical impulses, and from where it originally originates its electrical impulses. So this is a main property of the heart known as autorhythmicity. Sympathetic nerve supply increases the heart rate. So the autonomic nervous system basically involves the heart. Autonomic system includes the sympathetic and the parasympathetic. When there is sympathetic nerve supply, it increases the heart rate, increases the heartbeat, and when there is parasympathetic nerve activity or there is parasympathetic nerve supply, it decreases the heart rate. Heart also respond to the different hormones like adrenaline and thyroxine. It means when there is increased discharge of adrenaline, also known as the epinephrine, in the fight and flight condition, or when there is increased thyroxine, there will be increased heart rate. Okay, you can see in the picture, these are the conducting system of the heart rate. You can see the first SA node, sinoatrial node, present at the sulcus terminalis area at the opening of superior vena cava in the right atrium. The location of SA node is present at sulcus terminalis around the superior vena cava in the right atrium. The electrical impulses are being originated first automatically in the SA node, and from SA node the impulses are carried to the AV node. AV node is present between the atrioventricular valve. Atrioventricular node, as its name indicates, it is present between the atrium and ventricle. And here the electrical impulses goes to the atrioventricular bundle. Atrioventricular bundle is also present around the AV node. You can see in the picture, it's in the midline, AV bundle. That AV bundle continues to divide into right and left branches. Atrioventricular bundle is also known as the bundle of His. You can see in the picture there is left atrioventricular bundle branch and there is right atrioventricular bundle branches, and from these bundle branches into the small fine branches known as Purkinje fibers. The picture shows the network of the Purkinje fibers, and from Purkinje fibers to the apex of the heart. The lower side on the right side is the apex of heart. So this is the whole conducting system showing in the diagram that impulses is first generates in the SA node, from SA node into the AV node, and from AV node into the atrioventricular bundle, or also known as the bundle of His, and from bundle of His into the right and left AV bundle branches, and from right and left AV bundle branches into the Purkinje fibers. So the impulses are at fastest rate at the SA node, and they are slower at the Purkinje fibers. You can see in this diagram also showing the electrical impulses passing through the conducting part of the heart. First, it originates in the SA node and AV node, then the bundle of His known as AV bundle, and AV bundle branches right and left, and from right and left bundle branches into Purkinje fibers. This picture is showing the electrical impulses being carried out in the heart. Okay, again we have to see that SA node, we have to study about SA node, its location, as I have already told you, that is located in the right atrium near the opening of superior vena cava, and it generate impulses because it's electrically unstable. ये इतना ज़्यादा electrically unstable mean इतना fastest rate पे impulses generate करता है कि इसका rate जो है fires at around 60 to 80 times a minute. 60 से 80 times a minute it fires. SA node discharge faster than any other part of the heart, so it normally set the heart rate, and it's also known as the pacemaker of the heart. So when you are being asked about the pacemaker of the heart, you can say that SA node discharges faster and it also sets the heart rate. That's where it's known as the pacemaker of the heart. AV node location मैंने अभी आपको बताई थी. It's present at the wall of the atrial septum near the AV wall between the atrium and the ventricle, and it transmits the electrical signals from atria to the ventricle. As the name indicates, AV node, it transmits the electric impulses from the atria into the ventricle. The major point is this, that there is a delay of 0.1 second for the impulses to pass to the ventricle. So this allows the atria to finish contracting before the ventricle starts. So it is known as the AV nodal delay. When you are asked about the AV nodal delay, इसका मतलब ये है कि आपके पास इलेक्ट्रिकल इम्पल्स जनरेट हो रही है SA नोड में, एट्रिया में. एट्रिया जब पूरा कॉन्ट्रैक्ट होता है और जब वेंट्रिकल में आता है, वहाँ से आने में, इसको AV नोड तक आने में देर इज़ अ डिले ऑफ 0.1 सेकेंड. यहाँ पे आपको लिखा हुआ भी नज़र आ रहा है. दिस अलाउज द एट्रिया टू फिनिश कॉन्ट्रैक्टिंग बिफोर द वेंट्रिकल स्टार्ट. वेंट्रिकल के कॉन्ट्रैक्शन से पहले एट्रिया का पूरा कॉन्ट्रैक्ट होना ख़त्म हो जाए और वहाँ पे हमारे पास 0.1 सेकेंड का डिले आता है. तो दैट इज़ नोन एज अ AV nodal delay. Okay, it's also known as a pacemaker. It becomes a pacemaker basically if there is a problem with the SA node. The major pacemaker, the main pacemaker of the heart is the SA node. अगर वहाँ पे कोई problem आ जाती है SA node में, तो AV node can be considered as a pacemaker of the heart. And the firing rate of the AV node is about 40 to 60 beats per minute. The firing rate of the SA node is about 60 to 80 times a minute. It has a greatest and the fastest firing rate, and the AV node has lesser firing rate of about 40 to 60 beats per minute. And that electrical impulses from SA node to AV node, and then from AV node into the AV bundle or the bundle of His. Bundle of His you have seen in the previous picture कि उसकी location कहाँ थी. It originate from the AV node basically, and it crosses the fibrous ring between the atria and the ventricle. Then it divides into the right and left bundle branches. And within the ventricular myocardium, उसी के जो ventricular myocardium की जो wall है, उसी के अंदर these branches break into the fine fibers known as the Purkinje fibers. And the electrical impulses are slowest at the Purkinje fibers. So it transmits the impulses basically from the AV node to the apex of myocardium. You can again see from the previous picture, SA node, AV node, and AV node, and then bundle of His. Bundle of His is nearby the AV node, and there is a central. In the center, you can see the two branches, right and left bundle branches, and then there is the network of Purkinje fibers. So from Purkinje fibers, the impulse is being carried to the apex of heart. Okay, now you can see about the main factors that affects the heart rate. There are some factor given here that affects the heart rate, like gender. There is, in gender means male or female. In males there will be more heart rate as compared to the females, and autonomic system, when there is increased sympathetic activity there will be increased heart rate, and when there is increased parasympathetic activity there will be decreased heart rate. Sympathetic activity, also known as the fight and flight activity, and the parasympathetic is known as the rest and digest conditions. So age also affects the heart rate. It also increases or decreases the heart rate. and there are some circulating hormone, as we have already discussed about the adrenaline, also known as the epinephrine and thyroxine. When there is increased level of these hormones, there would be increased heart rate. And activity and exercise also affects the heart rate. When there is increased activity or you are doing the exercise, there would be increased heart rate. And where there is no exercise, no activity, then there would be diminished heart rate. And when there is increased temperature more than the 37 Celsius, there would be increased heart rate. Main important point, the baroreceptor reflex, you would study this later. This reflex also helps, or it also affects the heart rate. This reflex means when there is decreased heart rate, the reflex is being activated and it increases the heart rate. And there is emotional state in any anxiety, any excitement, and in any case of emotional state, it also affects the heart rate as way. It increases or it decreases the heart rate. So we have completed our topics of today's, the conducting system of the heart and the factor that affects the heart rate. I'm showing you this diagram again. The conducting system, I'm repeating it again. The conducting system start and the impulses start from the SA node, from SA node to the AV node, and from AV node into the atrioventricular bundle, also known as the bundle of Hess. And from atrioventricular bundle, the impulses goes to the right and left bundle branches, and from right and left bundle branches into the network of Purkinje fibers, and from Purkinje fibers to the apex of the heart. So this is the main conducting system of the heart. Thank you.